Hi, this is Dr. David W. Kim, and today's video rhinoplasty blog is about the crooked nose. Now, when someone has a crooked nose, it's often bothersome because they feel like it's very, very obvious. One of the reasons that this is an easy deformity to pick up by the eye is that we tend to see borders between light reflection and shadow very clearly. The brow tip aesthetic line represents these important borders. So the line begins under the shadow of the orbital bone just below the eyebrow. It comes down the side of the nose between the front, which reflects light, and the side, which is in shadow, and flares out toward the nostrils. These two lines should be parallel, symmetric, and overall unbroken in order to create a refined appearance to the nose. Now, someone with an obvious nasal fracture like this gentleman, you see the entire brow tip aesthetic lines on both sides have been shifted over to his right, and on the left side where the bone is collapsed, the shadow is very deep. In this young gal who had an injury when she was struck by a surfboard, you can see that the crooked deformity is in the lower half of her nose. So the cartilage portion shows an indentation, and the brow tip aesthetic line is disrupted. In some individuals, it's facial asymmetry as much as it is nasal asymmetry that creates the appearance or worsens the appearance of a crooked nose. In this gal, this is the midline of her nose, and this is the midline of her lower face. And the nose, in some ways, follows point A to point B. After surgery, by straightening her nose relative to her eyes, we've made an overall better appearance, but her nose still will not be perfectly straight relative to both landmarks. The anatomy of the crooked nose has a lot to do with the nasal septum. So this is the partition between the two sides, but this is also the wall that holds up all of the outer structures. Where the septum bends to the left or the right, it carries these outer structures with it. The septum, however, is seated and surrounded by the bony structure. So this is the septum here. It's surrounded by the cartilage that create the shape of the nose, but it's also cradled by bone, and the bone at the top of the nose also has great bearing on the position of the rest of the nose. So when there is a fracture or disruption of the bone, you can have a crooked nose deformity in the upper portion of the nose. If there is deformity or deviation of the septum down low, you can have external deviation or a crooked nose deformity in the lower half, or you can have both. In treating upper deformities caused by nasal fractures or bony problems, we make precise cuts in the bone and we reshape or reposition the bone into a more appropriate position. If it's a problem with the septum, we may have to place cartilage grafting on one side to camouflage these irregularities, or actually shift the septum over, or deconstruct and reconstruct the septum into a straighter orientation. This is the same gal. She had this crooked nose with a hollowing in her middle portion of her nose, and the bottom of her septum was veered off toward her left side, creating obstruction. So using cartilage techniques to fill in the area here that was deficient and reposition the septum along the bottom, we were able to allow her to breathe better and create a straighter appearance overall. Sometimes the septum is so disrupted and so deformed that we have to remove it and replace it with straight pieces of cartilage. This was the case in this young man. He had a boxing injury where the septum was completely smashed and pushed over to his right side. So we basically had to take the septum out, put it back in a straight manner to allow him to breathe and to appear straighter. Sometimes we have to take rib cartilage, usually from rib 5 or 6, if the crooked nose deformity is such that it's a severe trauma, a severe deviation, and there's loss or collapse of the bridge. In this gentleman, we placed a large rib graft that was placed on the bridge and integrated to a graft at his tip in order to support the supportive function of the septum, which was basically missing in this individual. So you can see his before and after and on his profile view, as well as his base view. So the crooked nose deformity is more than just rebreaking the nasal bones. The nasal bones are important, particularly for upper nasal deviation or upper nasal crooked problems. But when the lower half of the nose is deviated, it's often a septal problem, which may happen in isolation or in conjunction with the nasal bones. So techniques to readjust the position of the septum as well as reposition the nasal bones is important to have the ability to fix all types of crooked nose deformities.